If you can only do one thing for the casualty, stop him from bleeding to death. Early control of severe hemorrhage is critical. Injury to a major vessel can quickly lead to shock and death. Only life-threatening bleeding warrants intervention during care under fire. Life-threatening bleeding can be identified by several characteristics. There is pulsatile or steady bleeding from the wound. Blood is pooling on the ground. The overlying clothes are soaked with blood. Bandages or makeshift bandages used to cover the wound are ineffective and steadily becoming soaked with blood. There is a traumatic amputation of an arm or leg. There was prior bleeding and the patient is now in shock, unconscious, confused, or pale. How long does it take to bleed to death from a complete femoral artery and vein disruption? Casualties with such an injury can bleed to death in as little as 3 minutes. This is a femoral artery bleeding. It does not take long to die from this. All personnel should have a COT-C recommended tourniquet readily available and be trained in its use. Casualties should be able to easily and quickly reach their own tourniquets. Do not bury your tourniquet at the bottom of your pack. Where a tourniquet can be applied, it is the first choice of control of life-threatening hemorrhage in care under fire. Forget about direct pressure, pressure dressings, and anything else. If you have severe extremity bleeding in the care under fire phase, go directly to a tourniquet. The medic in this unit was killed in the battle in which the soldier was wounded. Others in the unit attempted to control the bleeding from this soldier's wound just below his left knee. The improvised tourniquets were ineffective and the soldier bled to death. Don't let this happen to your buddies. Apply a tourniquet without delay if indicated. The casualty and the medic are in grave danger when a tourniquet is being applied. The risk of further injury versus that of bleeding to death must be made by the person rendering care. Apply the tourniquet without removing the uniform. Make sure it is clearly proximal to the bleeding site. If you are uncertain about exactly where the major bleeding site is, such as in night operations or multiple wounds, apply the tourniquet high and tight, as proximal as possible on the arm or leg. Tighten the tourniquet until bleeding is controlled. If the first tourniquet fails to control the bleeding, apply a second tourniquet just above the first. Don't put a tourniquet directly over the knee or elbow. Don't put a tourniquet directly over a holster or a cargo pocket that contains bulky items. Unscrupulous manufacturers make and sell knockoffs that look very much like COT-C approved limb tourniquets. They have poor quality and numerous failures have been reported. There are many common mistakes made by first responders applying tourniquets. Not using one when you should or waiting too long to put it on. Not pulling all the slack out before tightening. Using a tourniquet for minimal bleeding. Putting it on too proximally if the bleeding site is clearly visible. Not taking it off when indicated during tactical field care. Taking it off when the casualty is in shock or has only a short transport time to the hospital. Not making it tight enough. The tourniquet should both stop the bleeding and eliminate the distal pulse. Not using a second tourniquet if needed. Periodically loosening the tourniquet to allow blood flow to the injured extremity. These lessons learned have been written in blood. Only use a tourniquet for severe bleeding. These wounds do not need a tourniquet. Neither wound is life-threatening. Bleeding is minimal. A tourniquet should not be used on these two wounds or other wounds like them where the bleeding is not severe. It is expected that tourniquet application will cause some pain, but it will also save your casualty's life. Tourniquets hurt when applied effectively. It does not necessarily indicate a mistake in application. It does not mean you should take it off. Manage pain per TC3 guidelines. After any tourniquet application, monitor the casualty closely to ensure that the tourniquet remains tight and that bleeding remains controlled. Reassess, reassess, reassess.